lipid is responsible for that lipemic serum. Which lipid? Excellent, Christine Kyle Briñas. What is the answer, Christine Kyle Briñas? Triglyceride. Period. Wala nang iba. Because my question is, what is that lipid responsible, guys, for turning clear serum to milky serum? Ay, isa lang po ang answer natin. What is our answer, children, again? That is triglyceride. Therefore, next question. Ma'am, what concentration of triglyceride will give you milky serum? What is the description that will give you, what concentration of triglyceride, guys, will give you milky serum? I am a very specific professor, children. Okay. What is that description? Concentration. The answer is what? More than 400. Guys, ang nakalagay exceeds. If in the choices, which of the following describes lipemia? A, 400 milligram triglyceride. B, 401 milligram per deciliter triglyceride. What is your answer? A or B? Kasi kailangan klarado tayo sa exam. Of course, letter B, because it says exceeds. Ma'am, bakit po ina-emphasize yan? Well, according to them, hindi po ako nagsasabi, children, ha? That was asked before in the licensure exam. Not just once, but several times. Kaya sabi nila, ano nga sinabi ni Big Rodriguez? Ano nga sinabi ni Ma'am? Exceeds. Take note, 400. Remember that. Mom, is not cholesterol. No. Mom, how about chylomicrons? Chylomicron is not a lipid. It is a lipoprotein. The question a while ago is, what is that lipid causing lipemia? So the answer is never chylomicron. The answer should be what? Triglycerides. And if the sample is lipemic, that will inhibit these analytes. Mom, ano yung sabihin po ng i-inhibit? False decrease. That is false decrease. Huwag kalilimutan. May phone in question. Ma'am, yung kailuria po ba, pwede ding description sa lipemic sample? Children, kailuria is being explained in urinalysis and body fluids. When you say kailuria, the urine sample turns milky white. Sa pagkakatanda ko, guys, I am not teaching microscopy, but that is one of my favorite subjects when I was in college, okay? Children, kailuria ending urea means the urine sample. Lipemia ending emia means the blood sample. So, my understanding of kailuria is the urine sample turns whitish. Sabi nga nila, whitish or milkish. Yan ang sabing ibang description. Whitish or milkish. And the reason actually, if my memory serves me right, has something to do with the lymph fluid. Sino dito yung mga flat ones sa UBF? Has something to do with the lymph fluid. Lymph, yung lymphatic fluid, the lymph fluid. Kasi napunta siya sa kidneys, lumabas tuloy sa urine. Kaya naging milkish or whitish. And they call it kailuria. Chyle, kinuha nila yung word na chyle because of the appearance of the lipemic sample. Kung tawagin nila, chylemic. But actually, it's because of the increased triglyceride. Did I answer your question, Mr. Tabunot? Maganda yung question ni Mr. Tabunot. Baka tanungin sa yun sa exam si kailuria. That was an excellent question of Mr. Tabunot Christian Joshua. Maganda yung tanong niya na yung guys, ha. Naku, baka tanungin ko, Ma'am, meron palang kailuria. Tama, magpasalamat tayo kay Mr. Tabunot. Ay ako, hindi ko rin maaalala yung kailuria na yan. Ako, hindi tinanong ni Mr. Tabunot. O, kung tanungin tayo sa board exam, Ma'am, hindi pala triglyceride. Hindi lipid. As far as I know, the lymph fluid. Huwag mong kakalimutan yan. In fact, di ba children, ewan ko ha, yung mga, hindi po ako nagtuturo ng parasitology ha, pero sa pagkakatanda ko nung aking college, 35 years ago children di ba pag ang urine naging kyloric, may parasite? Yes or no? Kaya maganda itong question na ito ni Mr. Tabunot Yung mga flat walls sa parasitology, hindi ba children kapag ang urine naging milkish, whitish, may parasite, that is a diagnostic feature. Yes, may ano pong parasite. Walang mag-google, walang mag-open ng book. Naku, nakakasabi ko magpasalamat kay Mr. Tabunot. That is an excellent clarification. Wuchereria Bancrofty. Excellent. Jerome Agawin. And Ray Mark Magleo. Kaya ayoko magturo ng para. Wuchereria. Kasi ang favorite ko, Erysipelotrix ruchopathiae. The cause of the red skin disease, which is different from the red leg disease. Sabi mo, Lord, kunin mo na ako, Lord. Ayoko na mag-board exam. Magkaiba yon. The red skin disease is my God, Erysipelotrix ruchopathiae. That is the red skin disease. The red leg disease, that is disease of the amphibians and the frogs. Take note of that, And the cause of the red leg disease, not in humans, but in amphibians, Aeromonas, under the group of the gram-negative gastrointestinal pathogens. The red skin disease is different from the red leg disease. Ang red skin disease, pantao. Ang red leg disease, pang-amphibians. Esicaluria, Wuchereria, Bancrofty na lang, guys. Wuchereria Bancrofty. Ewan ko ba? Hindi ko, alam mo, may something talaga ako sa mga parasite. Okay. Did you learn something new? Thank you so much, Mr. Tabunot. Papasalamat kayo sa kanya. Excellent yung clarification niya na yun. Okay? So, going back, requires chilling, page 50. Okay, blood. Ay, syempre, alam na natin ito, blood gases, ammonia, hormones, hindi lang PTH, hindi lang catecholamines, hindi lang gastrin. Most of the hormones test, guys, requires chilled sample when you delivered it to another hospital. Your hospital currently, ito, hypothetical lang, wala pala siyang facilities for hormone test. Ma'am, dadalhin ko po sa another hospital. Transport it, chilled. Okay? Hindi pwedeng naka-environmental temperature lang. Masisira ang mga hormones. Okay? Lactate, renin, and pyruvate sample should also be chilled when transported. Place on a what you call this, a container with ice packets. Okay? Photosensitive analytes. Guys, hindi na po itatanong si Bilirubin sa board exam. Diyos ko, syempre, licensure exam is a higher exam compared to your exams in the 3rd year and 4th year. Take note, higher. Ano sasabihin mo? Mom, when we were in 3rd year, the exams are so challenging. You should say thank you to your professors. Your exams were challenging. Mom, when we reach 4th year, we have so many online exams. Ay, magpasalamat ka na ikaw ay binigyan ng maraming exams. You see the faculty, how difficult it is to check exams online. Hindi lahat, guys, ng schools, there is an excellent learning management system that can automatically check the exams without even counter-checking. No? Yung iba, minamano-mano pa. Imagine, may professors mo, ang tsaga-tsaga nagbigay sa'yo ng exams. You should even say thank you to them. Bakit? Kasi ngayon, magbo-board exam ka. Siya ang maaalala mo actually. And you are now going to thank them and extend your gratitude. Kaya kung kinumplain mo siya sa faculty evaluation, it is so difficult to embrace now because during the licensure examination, siya actually ang maaalala mo. Kaya yung iba na iiyak because how can they make bawi of those evaluations? Photosensitive analytes. Ay, wag mo nang alalahanin si bilirubin. Hindi yan itatanong sa board exam. It's the porphyrin, it is the vitamins A and the vitamin B6. Take note of that. Kaya pasalamatan mo yung school mo, yung iyong dean, yung iyong department head, yung iyong faculty children na pinagtiyagaan kang turuan. Do not forget that. Next, it's not in your handbook, children, the rest, you may copy this. Or kung alam mo na ito, huwag mo na kopyahin, huwag mo na rin picture kasi alam mo na, kakadagdag lang yan sa iyong babasahin. Pre-printed barcode label, sinabi ko na yan kanina, applied after, let me say this again, after proper patient identification and after the specimen is collected, avoid pre-analytic transcription errors. Ma'am, ibig sabihin, the barcode generator is handy. Ay, oo naman. Paano nangyari? Di ba may barcode na na patient, wristband si patient, no? I-scan lang yon. Lalabas yon, barcode din, i-affix na lang yun sa test tube. However, it should only be affixed after sample collection. That is so important. Ayan guys, para magkaroon ka ng idea, you can take a photo of this para pag nag-aral ka, alam mo na ganyan. Okay? Ops, kaya sinasabi ko sa'yo, handy yan. You can bring it. Meron pang smaller niyan. Okay, na ipiprint na yung kanyang barcode. Do not forget that, guys. That is so important. There is an accession number. Pag tanungin ka sa lab management, collection date, tube type, nakalagay dyan, yung identification number ni patient, the name, may other ID number pa, paring other, government ID number, accession number of the sample, and you place there also the test, and also the time, the collection date, and the routine. Eto guys, may kulang ito pati time of collection nilalagay dito. Pati time of collection. What else? CSF, page 51. Eto, alam mo na to kaya lang uulitin ko lang baka magkalimutan po tayo. Preparing for lumbar puncture, page 51. If possible, we should collect 3 tubes. Nandiyan na sa page 51 mo ang 3 tubes. At least, children, at least 1 ml. Guys, pag tanungin ka sa board exam, what is the maximum CSF volume that we can collect? Maximum CSF total volume that doctors can draw from patient. Maximum pag tinanong sa exam maximum. Ano nakalagay sa mga textbook? 5, 4, 3, 2, 1. What is the maximum, guys? 4 ml. What is the minimum? 1 ml. And the first a vial should be chemistry, then microbiology, then cytology. Ops, alam ko na sabihin mo, Mama, tinuro po sa amin sa college hematology. Ay, tama yun. Mama, nakalagay mo po sa textbook hematology. Tama yun. Mama, bakit nakalagay sa slide mo cytology? Children, clinical chemistry po is analysis. Not all the time, they will place hematology. Why is it that we need the third tube? For study of cells. You need to count the cells and you need to observe the cells present in the CSF and you have to report it. Therefore, it is cytology test. Amen. Is it cytology test? Tandaan natin yan. Ma'am, paano kung isang tube lang po ang na-collect? Naku, tinuro na sa iyo ng college. Uulitin ko lang guys If only 1 tube of CSF is available, it should be given first to what section? Microbiology, of course. Followed by chemistry. Then the last is hematology. Huwag mong kakalimutan yan. Yan po ay Ma'am, bakit parang hindi ko alam yan? Alam mo yan. Tinuro sa'yo pa ulit-ulit, lalo na sa UBF. Sa clinical chemistry ka, hindi masyadong pinapansin yan, hindi binabanggit, pati sa micro. Pero sa UBF, ulit-ulit. Okay, do not forget that, guys. Next, this statement come from CDC. Yun din na nakalagay sa book mo. Pareho lang. What else? And, eto ang wala sa book. Take note, children, matagal na pong pinag-uusapan ang biotin interferences. Ma'am, what is biotin? Biotin is used as a supplement to for healthy hair, for healthy skin, for healthy nails. No, kahit i-search mo yan sa internet, search ka natin si biotin. Ganyan ang uso kayo pa nagde-lecture. Kasama na yung searching. O, tingnan natin ng biotin supplements. Ano ba yun? Biotin benefits. Baka tama. Children, ha? Biotin benefits. Actually, dumami na ang ano niya, it repairs tissues, it repairs injured muscles, it can even boost the functions of the heart, it can even boost the functions of the liver. Ang dami na. Dati hair, skin, nails lang yan. It can even reduce blood sugar. Ito reliable source itong binabasa ko na to. Ano ba to? Lazada ata. Hindi Lazada. So going back, Ma'am, ang biotin po supplements, tama. Ma'am, it's like a vitamin, tama. Ma'am, anong purpose niya? Una talaga, guys, for hair, skin yan, and nails, vitamin yan. Pangalawa, that is really good for functions of the heart and the liver, you know, to push the functions. Ano pa? It also boosts immune system. Nang matagal na pang pinag-uusapan sa biotin. Ano pa? It can even reduce blood sugar. Ang tanong, ay bakit siya kasama sa interferences, ma'am? Because it creates remarkable interferences in chemistry. It creates remarkable interferences in chemistry measurement. Copy this, people. Take a photo para hindi ka na mahirapan mag-copy ng mahaba. Guys, yan pa lang ang sumunod na pinakuha ko sa na picture, ha? Take note of that, guys, ha? Okay. Sabi ko nga, if there's one thing, marami nagtatanong dyan, Dr. Rodriguez, ano po bang pwede namin gawing reward sa'yo? Naku, lalo na ng on-site, yun ang mga tanong nila. Nothing, I said, nothing. If there's one thing that I will say, nothing, but if there's one thing that I will request, please stop the piracy of my books. Guys, nagkasakit na ako dyan. Ayokong makonsume ang oras ko ng kaka-explain dyan. Nababasa nyo naman yan sa inyong mga social media account. Sobra, guys, ang sakit ko dyan physically. No, physically. I don't want to suffer that same pain again. Okay? And the worst is to change the author of the book. I am still alive. My hair is still brown. Okay? Please, that is something that I cannot just accept. Ma'am, anong ibig sabihin ng biotin? It falsely increased. Take note, increased levels of biotin in plasma leads to false reductions of troponin T, TSH, and FSH measurements. However, increased levels of biotin in plasma sample also cause false increase of T3 and vitamin D measurements. Tandaan, children, pag increase ang biotin, pwedeng mag-cause ng false decrease of TSH, FSH, and troponin T measurement. However, it can also cause false increase also of T3 and vitamin D measurement or vitamin D concentration. Huwag mong kalilimutan yan. And biotin supplements can create analytic interference in biotin-based immunoassay. How about interferences in molecular diagnostics? It is not in your book, children. Actually, it is there. Kaya lang, I just would like to emphasize. Laboratory manipulations of nucleic acids are susceptible to interferences at various stages, including specimen collection and processing. Naliwanag ko na sa'yo kanina. What is the anticoagulant that should never be used take note, in nucleic acid testing? Hindi mo pwedeng gamitin yung anticoagulant na yan because it can be co-extracted together with the DNA and later on inhibit the DNA polymerase enzyme. That is none other than heparin. Tandaan mo yan, guys. That's why, what is the best anticoagulant? Ay, syempre, that is the EDTA. Introduction of inhibitory substances and contamination with false positive signals are among the significant interferences. What do you mean by false positive? That may increase the concentration of the results. That's why false positive signals. Huwag kalilimutan. And remember, RNA is labile in blood or tissues. Okay, RNA is labile in blood or tissues. Therefore, specimens must be stored appropriately by rapid freezing in liquid nitrogen if the extraction will be delayed. if the extraction will be delayed. Do not forget that. So, ma'am, ang RNA more labile than DNA checked. Take note. Next, standard guidelines. Okay. I will allow you to copy this. Isa-isahin natin. Ay, syempre, sabi nila, hindi ako nagsabi. Ha, ma'am, tinanong po yan sa lab management. Okay lang. Kahit sa lab management to itanong o sa clinical chemistry, it doesn't matter. ISO 170, wala pang pandemic ito. 2005, it is a general requirements for the competency to carry out tests and or calibrations, including sampling. Ma'am, pag itanong po sa board exam, what is that international guideline that explains or discusses the competency of the medical technologist, to perform calibrations of equipment, calibrations of methods in the laboratory? What is our answer? ISO 17025-2005. The competency to perform all the tests or special tests in the laboratory, not just in clinical chemistry, in the whole laboratory. What is our answer again? ISO 17095-2005. What else? And it's the single most important standard for calibration and testing laboratories. Take a photo, please. The single most important standard for calibration and testing laboratories. I said the competency of the person to perform calibration and to perform sampling testing. That is ISO 17025-2005. How about ISO 15189-2012? This is the competency of the medical laboratory, including the quality management in the medical laboratory. That is 15189-2012. The capability of the clinical laboratories and medical laboratories to develop their own quality management system to address the competencies in that laboratory. Ma'am, meron na pong standard guidelines on protective clothing. Wala pang pandemic. Wala pa pong pandemic ay meron na. Take note, the ISO 6529-2013. That's the reason why. Ano sabi ng ISO? Matagal na naming sinabi yan. Okay, walang pwedeng sisihin ang universe kasi hindi lang po pinaka-implement. In other words, when we purchase PPE suit, shoe cover, take note, kasama ang footwear, shoe cover, gloves, mask, face mask, they should pass the ISO 6529-2013 because it says here, determination of resistance of protective clothing materials to permeation by liquids and gases. Yun daw PPE suit mo, yun daw lab gown mo, yung iyong face mask, yung iyong face shield, goggles mo, what else? Footwear, gloves, hindi pwedeng tumagos ang liquids at saka ang gases because it should pass the ISO 6529-2013 standards. Huwag mong kalilimutan. Meron ako sinabi sa iyo last time, ISO 15189-2007. Eto, 15189-2012. Basahin mo po kung anong year. Be careful when shading your answer. The 15189-2007, this is about quality patient care through quality laboratory services. Yun ang sinabi ko under quality control lecture. The 15189-2007 children is about quality patient care achieved through quality laboratory services. But the 15189-2012, the quality management in the clinical lab. ISO 35001-2019, wala pa pong pandemic nito. Kaya ano sabi ng biorisk group? Tagal na namin ginawa yan. An introduction into the biorisk management standards. It defines a process to identify, assess, control, and monitor the risk associated with hazardous biological materials. Oh, the standards, the guidelines on how to conduct biorisk assessment, and not only that, how to control the risk in the laboratory, not just assess, not just identify, but control and monitoring. That is under ISO 35001-2019, pre-pandemic. The last one is the ISO 151-90-2020. Oh, I think this was released parang before pandemic pa to, sa tanda ko ha, before yung full blast ng pandemic in 2020. Oh, this is about the safety requirements in the medical laboratories. Do you have a biological safety cabinet BSc? Do you have a separate room where the staff can change their PPE suit? Are they wearing the correct PPE suit from head to foot? Very important yan. Okay, and then that is ISO 151-90-2020. Huwag natin kakalimutan the safety requirements in medical laboratories, not hospital, laboratories. Next, don't forget to take a photo, children. That's not in your book, and also those who do not have a book, take a photo. Next, how about, let's start now, carbohydrates. We're done with quality control, analytical methods, instrumentation, patient preparation, sample collection. Thank you, Lord. Let us now start with the pure clinical chemistry. Well, we always say that there is one hormone inside the body. Remember that. Ano po i-discuss sa carbohydrates? The test for diabetes mellitus. The different samples for measurement of blood glucose. The types of BM. Very important. And the emerging types of diabetes mellitus. May mga tinatawag emerging types of BM. Take note of that. So, ang tanong, laging opening salvo to sa carbohydrates, guys. Okay? What is the only hormone responsible, guys, the only hormone responsible for maintaining physiologic concentration of blood glucose? What is the only hormone responsible for maintaining the physiologic? That is none other than insulin. That is the only hormone known as hypoglycemic hormone. Okay? So, parang may nakalimutan ako. Ngayon ko lang naaalala. Hypoglycemic hormone. Do not forget that. Next question. Okay, next question, guys. Next question. What is that process which is being promoted by insulin? That's why it is known as a hypoglycemic hormone. What is that process which is being promoted by insulin and actually only by insulin? Take note, what is that process which is being promoted by insulin and only by insulin? Siya lang actually ang nakakagawa niyan. Wala nang iba. What is that process? Process which is being promoted by insulin and only by insulin. Sorry for the call. Hindi ko pwedeng mapatay, guys. What is that process? Tinatanong kita, what is that process which is being promoted by insulin and only by insulin? What is our answer? Glycogenesis. Do not forget that. Glycogenesis is only promoted by insulin and only by that hormone. Take note of that. Only insulin and only that hormone. And what is glycogenesis? That is the conversion of excess glucose to glycogen. The conversion of excess glucose to glycogen. Huwag kalimutan. The conversion of excess. Ma'am, kumain po ako ng pizza, pasta, chicken. Take note, chicken na, may pasta ka pa, meron ka pang cake, meron ka pang ice cream. Happen next, guys. Ay, tataas ang ating blood glucose. Ang tanong, ma'am, pag tumataas po yung blood glucose ko, meron na po akong diabetes mellitus. What is our answer? Oh, we should say thank you because we have insulin. That promotes what? Glycogenesis. The conversion of excess glucose to glycogen. Do not forget that. Next question. So what happened to hyperglycemic hormones? Now, what are hyperglycemic hormones? Well, we cannot do anything about it. When we say hyperglycemic hormones, well, these are generally made to actually increase the blood glucose concentration. These are made actually to promote the increase of blood glucose concentration. So, ang tanong, what are the examples of hyperglycemic hormones? What is the first? Well, the first is none other than glucagon. Glucagon, do not forget, is a hyperglycemic hormone and it promotes, do not forget, glycogenolysis. It actually promotes glycogenolysis. Huwag kalilimutan. It promotes glycogenolysis. What do you mean by glycogenolysis? That is the conversion of stored glycogen to glucose. The conversion of stored glycogen to glucose. The conversion of stored glycogen to glucose. Ma'am, bakit merong glycogenolysis? That happens during periods of hypoglycemia. That happens, take note, during periods of hypoglycemia. Huwag kalilimutan yan. That is so important. What else? And meron akong inaayos. Another hyperglycemic hormones. Number 2, we have cortisol. Take note of that. Number 2, we have cortisol and corticosteroids. We have cortisol and corticosteroids. Cortisol and corticosteroids promote gluconeogenesis. They promote gluconeogenesis, meaning the conversion of fats and proteins to glucose. Okay? Conversion of fats and protein to glucose. That is so important also. What else? And then we have, in your third, we have catecholamines. The catecholamines, do not forget, the epinephrine and the norepinephrine also promotes glycogenolysis. Next, we have the thyroid hormones T3 and T4 are also hyperglycemic hormones and they also promote glycogenolysis. And also we have somatotrophic hormones or the growth hormone. The somatotrophic hormone or the growth hormone, do not forget that, also promotes, take note, glycogenolysis. Ma'am, ibig mong sabihin, si somatotrophic hormone is also a hyperglycemic hormone. Yes, because it also promotes, do not forget, glycogenolysis. Next, and then we have the somatostatin. Somatostatin is always described as a hormone-inhibiting hormone. Do not forget that it is a hormone-inhibiting hormone because it primarily inhibits insulin. Primarily inhibits insulin. Do not forget that. So that is the reason why it is a hyperglycemic hormone. That is the reason it is a hyperglycemic hormone. Take note of that. Very important. So, if you will ask me again, let us summarize. Ma'am, ibig mo sabihin there are several hyperglycemic hormones against one hypoglycemic hormone? Correct. That explains, children, Is it true that these hormones, if the concentrations of these hormones turned hyper, this may lead to hyperglycemia and eventually diabetes mellitus? Check. Remember that these hyperglycemic hormones, if the concentrations in plasma are all abnormally increased and persistently and consistently abnormally increased, it may lead to hyperglycemia and later on diabetes mellitus. Papaliwanag ko yan later. So, anong tatandaan natin, children? Well, no doubt about it. There is definitely one hypoglycemic hormone and there are several hyperglycemic hormones. Take note. You include also the ACTH, the adrenocorticotropic hormone. ACTH is another hyperglycemic hormone. Kaya pag tinanong ka, very simple sa board exam, which of the following is a hyperglycemic hormone? There are 7. Which of the following is a hypoglycemic hormone? Insulin. Bakit hypoglycemic? It is the only hormone that promotes the conversion of excess glucose to glycogen. And what is the process? Glycogenesis. Not only that, insulin also promotes glycolysis, the lysis of excess glucose. The lysis of excess glucose to prevent hyperglycemia. Then, what is diabetes mellitus? Well, it is a group of metabolic disorders characterized by hyperglycemia. Guys, sasabihin mo lang po na ang pasyente ay may diabetes mellitus if there is hyperglycemia. Let me say it again. You will only say it is DM if there is evident hyperglycemia. And the hyperglycemia is either, number 1, due to insulin secretion or defect in insulin secretion. Number 2, defect in insulin receptors. Wag naman sana both. There is a defect in insulin secretion. There is a defect in insulin receptors. Ma'am, pwede ba yun si diabetes mellitus? Meron ng defect sa secretion? Meron pang defect sa receptor? Pwede. That is so difficult to manage according to the clinicians. So therefore, one thing is so clear. Diabetes mellitus will only happen if there is hyperglycemia, and hyperglycemia is a product of what? Either defect in insulin secretion or defect in insulin receptors, or, very difficult, both. Next question. Mom, what is the definition of hyperglycemia? Because we know that that is elevated blood glucose concentration. Up to what level? Hindi up to. What is the definition of hyperglycemia? It is based on fasting blood sugar level or fasting blood glucose level. At anong ibig sabihin nun? If the FBS is 126 milligram per deciliter or greater, umeksakto lang ng 126, anong tawag na natin doon? Diabetes mellitus. Take note of that. If the FBS level, do not forget, is exactly 126 milligram per deciliter or greater than 126 milligram per deciliter, how do we call that? Diabetes mellitus. Ma'am, pag tinanong ko po kami sa board exam, what concentration of FBS is signed indication of DM, we should look for that answer, 126 or greater. What is the answer? Yes. Mom, if in the board exam we are asked simply, how will you define hyperglycemia? Ganun lang ma'am ang question. We should always look for that answer. FBS of 126 and greater, that is also definition of hyperglycemia. Yes, because hyperglycemia starts with a baseline measurement. What is that? FBS. Diagnosis of DM starts with the baseline measurement. What is that again also? Measurement of FBS. What else? Mom, how about glucosuria? Glucosuria occurs when the plasma glucose level exceeds 180 milligram per deciliter. Oops, that is with normal renal function. Mom, ibig mong sabihin, yung patient, umiihi siya, may kasamang glucose, still normal renal function. Correct. Remember, because there is renal threshold for blood glucose. Ano sabi ni kidneys? Nako, sabi ni kidneys, Oy, glucose, makinig ka ha. Sabi ni kidneys yun kay glucose. Oy, glucose, makinig ka ha. Ano sabi naman ni kidneys? Okay. Ay, sorry, sabi pala ni glucose, okay. O ano sasabihin mo, kidneys? You can stay in my blood. Bakit si kidneys lagi yung sinasabi my blood? Because the kidneys are the only organ that maintains blood volume and anything in that blood volume. Let me say that again. One of the functions of the kidneys, do not forget, is to maintain blood volume and anything in that blood volume, all the analytes, the concentrations are maintained by the kidneys. Take note of that. So therefore, ang tanong, mga pasyente po na may trace, plus 1, plus 2, 3, 4, glucose sa urine, may renal dysfunction? Oh, not all the time. Because the kidneys can only hold up to, take note, 180 milligram per deciliter plasma glucose. Let me say that again. Our healthy kidneys can only hold up to maximum of 180 plasma glucose. So ano sabi ni kidneys by glucose? Kapag tumungtong ka ng 181 milligram per deciliter, wala na tayong pag-uusapan. You will be automatically out of the human body. Ano sabi ni glucose? Okay. Binigyan siya ng warning. Because the renal threshold for glucose is only up to 180. So more than 180 is glucosuria. Ma'am, bakit nakita ko sa book, ang renal threshold for renal threshold for blood glucose is 160 to 180 milligram per deciliter. Kasi po may mga pasyente, take note ha, may mga pasyente guys na kaya nang nakalagay na 160 to 180 ang renal threshold for glucose. Pero kasi mga patient na pagtungtong na 161, meron ng glucose sa urine. 172, meron ng glucose sa urine. Kaya pala mo 160 to 180 is already the start of glucosuria. Correct. Pero isa lang ang talagang very evident. Glucosuria will only come out if the plasma glucose level exceeds 180, meaning 181 and above. True or false? Ito ha, true or false. Therefore, urine glucose test is part of the diagnostic tests for diabetes mellitus. Therefore, since there is glucosuria, therefore, urine glucose test is part of the diagnostic tests for diabetes mellitus. True or false? Ma'am, wala po akong ganyang nabasang statement sa mga books because clinical chemistry is analysis. Kung halimbawa hindi tayo nagkita ngayon, tinanong ka sa board exam, urine glucose test, take note, is part of the diagnostic tests for diabetes mellitus. What is our answer? False. Mag-reflect ka ng third year. Clinical chemistry. Sinama ba ang urine glucose test sa diagnosis of DM? What is the answer? No. Why? Because diabetes mellitus starts if the FBS is 126 milligram per deciliter. Kapag 126 ang iyong FBS, wala ka pong glucose sa urine. Pero may diabetes mellitus ka. 130, 140, 150, 170, meron ka na pong diabetes mellitus doon. I-check mo yung urine mo. Oh, negative urine glucose. But you already have DM. Take note of that. FBS level of 170 is DM. 130, 140, 150, 160, DM. 180, DM. Glucose in urine, negative. Because the glucose will only come out if it is more than the plasma threshold for glucose. And what's the maximum plasma threshold for glucose? 180. Yun lang ang kayang dalhin ng iyong kidneys, 180. Pag lumagpas ng 180, ang blood glucose mo, ano sabi ni kidneys? Ang bigat mo na blood glucose, hindi na kita kaya. You'll be out of the body system. That's why there is glucosuria. Tanong, si urine glucose test part ng diagnosis for DM? Because may diabetes mellitus ka na based on FBS, wala ka pang glucosuria. Remember that people and glucosuria occurs with normal renal function. One of the discrete functions of the kidneys is to eliminate excess glucose. Otherwise, the kidneys will be destroyed. a table in your book. Those who don't have it, take note of the type 1 and type 2. Guys, very clear ha, former name ang nakalagay, hindi po otherwise known as. Look at my eyes. Hindi ko sinabing otherwise known as, also known as. Oh, I didn't say that. It is former name. Take note of that. Because according to WHO, American Diabetes Association, CLSI, we don't say also known as. We say formerly known as. Insulin-dependent diabetes mellitus, juvenile onset DM. Ma'am, ibig mo sabihin si type 1 DM, hindi na po insulin-dependent. Ay naku, insulin-dependent pa rin. However, the reason why it is formerly known as because there are type 2 DM patients who are also receiving parenteral insulin. So therefore, sa panahon ngayon, nakakita ka ng pasyente may diabetes mellitus, nagsi-self-administered ng insulin parenterally, iisipin mo, ay, siguro type 1 yan, ay, pwede ring type 2, truly. Kaya nakalagay formerly known as, because there are now type 2 DM receiving insulin. Formerly juvenile onset, why? Eh, merong 5-year-old 5-year-old child, type 2 DM. Ay, kaya pala ma'am, formerly adult onset. Correct? So, diabetes now is what? Any age. Type 1, pwedeng 50-year-old, saka lang discover. Type 2, pwedeng 5-year-old na discover na. Ay, that's why it is of any age. Take note. Kaya former name. And autoimmune distraction is the #1 cause of type 1. It's very difficult to explain, guys, that the own immune system of the patient destroys the pancreatic beta cells. And that is the source of insulin. That is the reason why type 1 DM is also known as immune-mediated diabetes mellitus. I said also known as, because the main cause of type 1 DM is autoimmune destruction of the site of insulin secretion. That is the beta cells. Ang type 2, insulin receptor deficiency or defective insulin receptors. Kaya nakalagay dyan, the insulin and glucose cannot enter the cells because of the absence of effective insulin receptors, causing insulin resistance. What is that? Type 2 DM. That is the most common cause of type 2. Siyempre, ang most common type of DM, yung type 2. Bakit? Siya kasi yung hereditary type. Ma'am, ibig sabihin ang type 1 hindi hereditary. Meron na rin. Ang type 1, marami ng research on children, hereditary na rin. However, which one is the higher genetic hereditary talaga? The type 2. C-peptide test is a test that will differentiate the type 1 from type 2 diabetes mellitus. You get fasting serum sample, 8 to 12-hour fasting serum. Oops, mineasure mo ang C-peptide sa fasting serum. Nako, ano ang result? 0 level, undetectable, negative, or if it is present, decreased concentration, type 1 DM. E pag normal concentration, detectable, positive, that is the type 2 DM. That's why C-peptide can differentiate type 1 and type 2 DM. Another test that can differentiate type 1 and type 2 DM, we have the pre-diabetes test. These are actually autoantibody tests. What are the two very important autoantibody tests? The GAD65. What is GAD? Glutamic acid decarboxylase. It is in your book. Glutamic acid decarboxylase under type 1 DM. Ano ang pangalawa? IAA. Ano yung IAA? Insulin auto-antibody test. Take note, insulin auto-antibody test. Oops, wag mong kakalimutan, nag-positive. Si person, si patient, both auto-antibodies. Anong sabi? You are a future type 1 DM. Bakit future? Wala ka pa sa category ng DM. Hindi pa umaabot ng 126 ang iyong FBS. Nag-positive ka rin sa dalawa. Oh, that is a sign of a future DM type 1 patient. Ma'am, pareho po ako negative sa auto-antibody test. Therefore, you are a type 2 DM patient. Naku guys, huwag mong kakalilimutan. Yung naka-red yan. To be very specific, because I'm a very specific professor, children, the insulin auto-antibody is usually present in children. And the GAD65 is usually present in adults. Next question. Ma'am, paano namin i-confirm na type 1 DM yun? Kailangan po ba present si GAD or IAA, or it should be both? Well, according to WHO and according to standards, there should be 2 positive autoantibody tests before we can say it is a future type 1 DM. Bakit ma'am future? Kasi di ba umabot yung FBS ng 126? At hindi umabot ng 126, di ba pwede sabihin DM? Kaya ano nakalagay dyan? Pre-diabetes test. Mom, in my family, we have family tree, branches, stems, roots of diabetes mellitus, mom. But I had my biochemistry test just last week, mom, and the result of my FBS was 99. Oh, you are in the demarcation line. Mom, you mean I can put myself in an autoantibody test. So if my result was negative, I'm a future type 2. If my result is positive, both, I am a future type 1 DM patient. Yes. Siyempre, gusto mong itanongin ito, ma'am, paano ko i-bless ako ni Lord? Hindi talaga ako magde-develop ng type 2, type 1 or type 2. I am so blessed, ma'am. Ano po result ng aking autoantibody test? Also negative. It means, ma'am, if the result is negative autoantibody tests, meaning 2, either you will end up as type 2 DM, or you are so blessed, you are free of DM in your lifespan. What is the answer? Yes. Ketosis, ay common ang type 1 because of the absolute absence of insulin. Rare naman sa type 2. Ano ba medication ng type 1? Parenteral insulin. Ma'am, sabi mo si type 1 hindi na siya insulin dependent, diabetes mellitus. Ay, hindi talaga. Kasi there are now type 2 DM patients receiving insulin. That's why, formerly known as IDDM, formerly known as NIDDM. Actually, for type 2 DM patient, ang talaga pong binibigay ay hypoglycemic drug. Kaya lang po, they cannot manage their lifestyle. So, ano nangyari? Sobrang taas na po yung kanilang sugar. That's why they were given insulin. Next, recommendations, page 59. It is recommended that all human beings, all human species should undergo FBS test, age 45 and older, every 3 years, but screening should be earlier and more frequently if the individual is at high risk. Ibig sabihin ng high risk, your family tree, branches, stems, and roots with diabetes mellitus. Ay, huwag mo na antayin yung 45 years old. Now na. Ay, huwag mo na antayin yung every 3 years. Every year. Take note. Tanong, ma'am, ano pong i-measure? It is actually the fasting plasma glucose or HbA1c. Actually, ang mga doctors, based on my experience, both ang nire-request nila, hindi or, and. Ma'am, bakit dyan nakalagay or? Yun ang sinabi sa ating reference book. So, sino po susundin namin? Ay, syempre, yung reference book. Which of the following should be used as a screening test for individuals aged 45 and older to screen if they are diabetes mellitus patient? FBS. The FBS is the screening test, the universal screening test for DM. Next question. Mom, the result of the FBS was 126 and greater. What is the next test? There should be HbA1c. In short, you don't start with HbA1c. The first should also always be the screening test for DM, FBS. You only request HbA1c if the FBS is what? 126 and greater. That is the usual protocol. Kaya nakalagay or. I-request ang HbA1c mo pag na-prove na mataas pala yung FBS. Gano'ng kataas? 126 and higher. What else? Copy this, people. Lahat kayo Fulminant type 1 diabetes, abbreviated FT1D. My goodness gracious. It is formerly known as idiopathic type 1 DM or type 1B. There is type 1 and there is type 2 DM. Period. There are only 2 major types of DM. Only 2 major types of DM. Type 1 DM and type 2 DM. Wow, there is fulminant type 1 diabetes mellitus, FT1D. Oops, formerly known as, what is idiopathic? Unknown. Dati unknown yan. Sino ba itong unknown na to? Idiopathic type 1 DM. Ano ba itong unknown na to? Type 1B. Pero ngayon, may pangalan na siya. Fulminant type 1 diabetes. I didn't say otherwise known as. I said formerly known as. Take note of your book when nakalagay dyan, idiopathic. It is now fulminant type 1 DM. OBS, it is strongly inherited and associated with the absence of beta cell antibodies. Ma'am, sabi mo pag absence of beta cell antibodies, lang, ma'am, bakit siya tinawag na fulminant type 1? Alam mo, si Ryan Morleta, ako board of examiner, guys, kung ako lang naman, ha, itatanong talaga ito sa board exam. Kaya huwag kang magugulat if this will be asked in your board exam this August. Take note of that, children. What is this type of diabetes? Which is a little bit confusing then, kaya tinawag nila then na idiopathic type 1 DM because they don't know the cause. Why? Can you imagine? Zero antibody test. Ma'am, type 2 DM? Hindi. Why? Because they realize this type of DM has rapid and complete beta cell destruction. Ma'am, absence of insulin but zero auto-antibody test. Correct. What is that? Fulminant type 1 DM. Are you learning, children? Nagkakaintindihan ba tayo, mga kapatid, sa paniniwala? This is a mixed DM. Did you understand the fulminant type 1 DM? Take note of that, guys. Basahin mo pong maigi ang question. It is a subtype of type 1 DM with aggressive progression of hyperglycemia and ketoacidosis. Take note. Subset of type 1 DM with aggressive progression of hyperglycemia and ketoacidosis. Read the question carefully. Next, what is acanthosis nigricans associated with endocrine dysfunction? Copy this also and take a photo. Do not forget this, children. It is insidious in onset. Huwag ka muna mag-take ng picture or copy. Patients are often obese and this is characterized by positive insulin resistance syndromes. Mapupunta na naman sa mind mo. Ma'am, type 2 DM? Ay, hindi po. Hindi to type 2 DM. Ano tawag dito? Hyperglycemia associated with endocrine dysfunction. So what is that hyperglycemia associated with endocrine dysfunction characterized by insulin resistance syndrome? Acanthosis nigricans associated with endocrine dysfunction. Do not forget this. Take a photo, please, of type A, hair on. Ang tawag sa kanya, hair on. H-A-I-R-A-N. And we have the type B syndromes. This is actually associated with hyperandrogenic. Androgen means the testosterone and the estrogen. Androgen cell. Insulin resistance and acanthosis nigricans. And the type 2 is mostly the uncontrolled diabetes and also associated with polycystic ovarian syndrome. Ma'am, hyperglycemia, insulin resistance, but not type 2. Tama. Take note, common among patients with uncontrolled DM, autoimmune disease, polycystic ovarian disease. Do not forget that. Take note of that, people. Next, microalbuminuria test, page 99. For the microalbuminuria test, take note, this is an early, naka-green yan na early indicator of glomerular dysfunction associated with type 1 DM. Early indicator of glomerular dysfunction associated with type 1 DM. This is a test. Take note. Bakit early? Microalbumin pa lang ang concentration sa urine. Kailangan na nating i-check. And remember that one of the complications of diabetes mellitus is nephropathy. Again, one of the complications of diabetes mellitus, do not forget, is nephropathy. Take note of that. So it is an early indicator of glomerular dysfunction associated with type 1 DM. Mostly ang patient na may microalbuminuria test, type 1 DM. It is considered as routine test for DM patients. Oops, ma'am, ibig mo sabihin, FBS and microalbuminuria tests are both routine tests for DM patient? Correct. Both routine tests for DM patients. Huwag kalimutan. Ma'am, si type 2 DM, pwede rin mag-microalbuminuria test? Ay, syempre, pwede din sa type 2, pwede din sa type 1. Kaya lang ito, madalas nire-request sa type 1 because they are so prone with nephropathy because of the persistent and prolonged hyperglycemia. Next question. Children, hindi lang po ito isang beses minimeasure. Hindi ko na makain yung tissue. Usually, 6-month period. 3 times magsasubmit ng urine, 6-month period, 3 times magsasubmit ng urine. So it's like every 2 months. If 2 out of the 3 specimens, 2 out of the 3 specimens positive for microalbuminuria, then that is the only time you will declare positive microalbuminuria. Ma'am, paano kung 3 samples, isa lang ang nag-meet sa microalbuminuria standard? Is it positive microalbuminuria? There is another urine sample, 4th sample. Kasi kailangan talaga confirm. Dapat 2 beses, mas maganda nga 3 beses. Pero 2 lang in 3 specimens, confirm microalbuminuria. Random spot albumin creatinine ratio. This is the instrument from Siemens that we will be using in measuring microalbuminuria test. Reference value, syempre 0. Tinuro sa atin yan sa UBF, di ba? Dapat walang albuminuria, even microalbuminuria, dapat 0 concentration. Oops, however, baka tanungin sa board exam, there are some individuals that the urine albumin will be 10 microgram, 20 microgram, 29 microgram, 28 microgram. That is still considered normal. And what are these individuals? Who are these individuals that will have microalbumin up to 29? Up to 29 is still considered physiologic. Athlete, marathon runners, guys, after what you call this, during high fever, no, 39, 40, 41 degree body temperature, kumuha ka ng urine sample, check mo yung microalbumin, ay, 14 microgram, normal pa rin. Pero, pag umabot po ng 30 to 300, that is microalbuminuria. That is microalbuminuria. O, kailangan 3 specimens, 2 ang umabot ng 30 to 300. Question. Alam ko itatanong mo to, sasagutin ko. Ma'am, di kasi kami nag-face-to-face. Okay. Ma'am, in our discussion in urinalysis, there is a urine strip. Check. With multi-pads. Check. Ma'am, yung bang urine strip with multi-pads, di ba there is one pad that says protein pad? Check. Ma'am, that protein pad can also check microalbumin? No. That protein pad, if it turns trace, that protein pad, if the result turns trace, oh, that is clinical albuminuria. Ibig mo sabihin, ma'am, that trace in the protein pad is not 30 to 300 microgram. No, it is greater than 300. So, ibig mo sabihin, ma'am, if I will use that urine strip and dip it into that urine with microalbuminuria defined as having 30 to 300 microgram per milligram of albumin in urine, negative po ang result doon sa urine strip with protein pad, which is used in routine urinalysis. Negative. Because, remember, pag nag-trace, greater than 300. And that is not microalbuminuria, that is albuminuria. Clinical albuminuria. Kaya ginagamit mo this instrument for measurement of microalbumin. Ma'am, ano po ang urine? 24-hour or random? Random, you see, random urine. Make sure, not bloody urine. Pag bloody ang urine, repeat collection po yun. Because that is false increase of albumin. Next type of DM, type 1, type 2, and there is GDM. Ma'am, nakalimutan mo yung fulminant type. type DM is a subtype of type 1 DM. Tandaan mo, subtype. Bakit subtype? Because of the complete beta cell destruction. Ma'am, complete beta cell destruction na pala. Ba't hindi lang type 1 DM? Because type 1 DM is absolute destruction of the pancreatic beta cells and absolute absence of insulin. Tandaan mo guys, ang type 1 DM, absolute absence of insulin. Kaya nga sinasabi, type 1 DM is destruction of pancreatic beta cells, correct? Bakit pa merong subtype of type 1, ma'am? Because when they draw blood from this presumed type 1 DM, ay walang autoantibodies. Ay hindi pwedeng type 1 DM yun kasi pag type 1 DM with autoantibodies. And there should be two to confirm type 1 DM. Pag isa lang, hindi ka pwedeng mag-confirm ng type 1 DM. Should be two autoantibodies. Guys, nagkakaintindihan ba tayo? Kaya pagka zero yan, but beta cell destruction, fulminant type 1 diabetes mellitus. Is it clear, guys? Yan ba ay klarado? Is it clear? 128 students in the platform. Nandito pa ba kayo sa platform o naka-on lang yung inyong mga Zoom? Because that is a very important explanation, which is different from GDM. What is GDM? Well, this is only for this one occurs during pregnancy, obviously. Impaired ability to metabolize carbohydrate. This is impaired ability. Papatayin ko lang yung light, guys, kasi mainit na tong light ko. Mainit pa tong nasa window kasi ako nakatapat. I forgot to place our sunblock. Okay. Saka madali ko, children. Hindi prepared ang hair ko ngayon. So, hindi prepared, di ba? Saka madali ko. Okay. So, going back, guys. Okay, sabi ni Miss Francia. Present, ma'am. Thank you so much, Miss Francia. Miss Francia Togores. Okay. Gestational DM, children. This one develops during pregnancy. Why? One, because of the absence of insulin. Second, probably absence of insulin receptors. Okay. So, ang tanong, ma'am, this should disappear after delivery. Ay, tama. It should disappear after delivery. What else? And diabetic women who become pregnant are not included in this category. Kapag yung patient, yung pregnant woman, ay DM na siya, meron na siyang diabetes mellitus before pregnancy, then pregnant siya, hindi mo pwede tawagin GDM yon because GDM only develops during pregnancy. Meaning, hyperglycemia only develops during pregnancy. Take note of that. Ma'am, so pagtanungin po sa board exam, binigyan kami ng situation. A 37-year-old female patient was confirmed pregnant. Then there was a case, etc., etc. Then also the history of the patient was FBS of 142 before pregnancy. So how will you classify the patient? DM, not GDM. Screening test is 2-hour OGTT. That is the screening, which also serves as what? Confirmatory test. Both screening and confirmatory tests. And usually, the OGTT should be performed between 24 to 28 weeks of gestation. In other words, the last trimester of pregnancy. Guys, tandaan mo na ang board exam po analysis ha, clinical chemistry is day 1, subject 1. Hindi yung nabasa mo sa book, hindi yung sinabi ko sa lecture na verbatim. Ang makikita mong statement sa board exam, in fact, it is a miracle kung mismo eksaktong statement lumabas sa board clinical chem, miracle yun. Because clinical chemistry is always analysis. Remember that. Ma'am, wala naman nakalagay dito yung last trimester of pregnancy. Ay, that is 24 to 28 weeks of gestation. That is the last trimester of pregnancy. Remember that. Next question. And there are 2 methods for OGTT. We have the one-step method, and the one-step method is commonly used. The one-step method OGTT, using the standard glucose load of 75 gram glucose that you will tell the patient to drink the 75-gram glucose load dissolved in water. The second OGTT for GDM patients, we have the two-step method. When you say two-step, there are two steps. Kaya two-step method, there are two steps. There is a priming dose or there is an initial glucose load tolerance. There is an initial glucose load tolerance, GLT. Anong GLT? Glucose load tolerance. There is an initial load. What is the initial load or priming dose? 50 grams. Take note. After the priming dose, the result of the tolerance test was increased. No? Ang taas ng kanyang plasma glucose, no? More than, take note, 140 and higher. 140 and higher milligram per deciliter after the 50-gram priming dose, 50-gram glucose, take note, the result was 140 and above milligram per deciliter plasma glucose. Oh, there should be a follow-up dose. And that is the second step. What is the follow-up dose? 100-gram glucose load. Yun ang tinatawag na follow-up dose. So, ang tanong, what is the commonly used OGTT method? What is the answer? The one-step method. What is the standard glucose load? 75 grams. What is the two-step method? OGTT. There are two steps involving two doses. The priming dose or initial dose, 50-gram glucose load test. Yun yung GLT. And what is the follow-up? 100-gram glucose load. When is the time you give the follow-up? If the priming, the first step is 140 and above milligram per deciliter plasma glucose. Next, and diagnostic criteria, yung mga may book, meron na kayo niyan ha, idagdag nyo lang to one-step method, IADPSG. Mamaya bibigay ko yung definition. Yan ang mga basis for interpretation. Basis, there are three values, no? FBS greater than, and equal. International Association of Diabetes and Pregnancy Study Groups, diyan ang galing yung values yan. That is being used universally. Interpretation. Naku, paano ba interpret? GDM is diagnosed if one of the three criteria is met. Take note, ha? GDM is diagnosed if one of the three criteria is met. Ma'am, ibig sabihin po yung FBS 92, binigyan ka ng case sa board exam. Huwag ka magugulat, ha? Ma'am, marami po kaming clinical case ngayong board exam. Dati pa naman meron, pero ngayon parang feeling ko baka madagdagan. Kasi yung curriculum mo masyadong obidized, outcome-based talaga yan. I'm sure sasabihin mo sa akin, Mom, nung third year po kami, tsaka fourth year, yung exam po namin, laging may Morse type. 1, 2, 3, 4, 5, A, B, C, and D. That is a clinical case, analytical type of question. Mom, yung exam po namin, laging a 35-year-old, a 40-year-old something, a 1-year-old clinical case. Problem-based learning, outcome-based question yan. Next, Mom, yung exam po namin ng college laging, the first statement is correct. The second statement is correct. Both statements are correct. None of the statements. Mom, lagi kaming ganun, Mom. Magpasalamat ka sa iyong professors. Yun ang binigay sa iyong exam. Bakit? Kasi baka ngayong board exam may ganun din. Ma'am, dati po ba may ganun na? Ay, meron na. Eh, bakit po sinasabi ko yun? Baka madagdagan. Dati mga 10 questions lang, 15 questions lang. Baka ngayon more than. So, anong nare-reflect mo ngayon? Naalala ko yung professors ko nung sa clinical chemistry. Sometimes I don't like them. Because they're always giving those questions. Ayan, si Dr. Rodriguez, paborito niya ang Morse type. Ako, pag yan ang professor mo, 1, 2, 3, 4, letter A, 1 and 2, letter B, 2 and 3. Naku, paborito yan ni Madam. Pangalawang paborito niya, problem-based. A 36-year-old patient is with like this and like that. Bakit? Kasi baka ma-encounter mo ulit yun sa board exam. Ma'am, kaya pala. Kaya wag ka nang magtatampo sa professors mo. Pasasalamatan mo siya. GDM is diagnosed if one of the three criteria is met. Very good. So in other words, Ma'am, 92 po yung FBS, pero yung 1 hour, 179, okay? Yung second hour po, 152, okay? Is it GDM? Yes, kasi one of the three criteria is met. Ma'am, yung FBS po 91, okay? Yung 1 hour po 180, okay? Yung second hour po 152. Ay, may isang 180. Oh, that is also GDM. Alam ko na tatanungin mo rin ito sa akin. Ma'am, you mentioned last time that the reference value of FBS universally is 70 to 99 milligram per deciliter. Correct. Eh bakit dito ba 92 pa lang? GDM na. Oh, this is a special criteria designed for pregnant woman. Ibig sabihin, basahin mo maigi yung question. Para lang question ni Mr. Tabunot kanina yan. No? Di ba? Happy-happy ka. Uy, thank you, Mr. Tabunot. Pinaalala mo sa amin yung kay Luria. Which is different from chylomicronemia. Which is different from lipemia. Nako. Anong ibig sabihin nito? Ma'am, di ba sabi mo yung FBS 70 to 99 milligram per deciliter? Tama. Eh bakit 92 ba? Meron ng gestational diabetes mellitus. Children, this is for pregnant women. So basahin pong maigi yung question support. What is the recommended fasting blood sugar cut-off if that is a pregnant patient? Up to 91. Because up to 91, FBS is considered non-GDM. Pag tumungtong ng 92 ang FBS, ano sabi? GDM. Eh kung non-pregnant ma'am, female, up to 99 is considered non-DM. Nagkakaintindihan ba tayo mga kapatid sa paniniwala? Basahin mong maigi yung question. Non-DM male. GDM up to 91 is considered non-GDM. Non-GDM. Take note of that. Fetal risk, if that's confirmed GDM, ano mangyayari kay baby? Possible respiratory distress syndrome, may develop hypocalcemia, jaundice, there is even microsomia or increased birth weight. Mom, there should be postpartum evaluation. Babalik po si former GDM. Bakit former? Nanganak na siya. Hindi mo pwede tawagin GDM yung kasi nanganak na. But there should be again OGTT. Mom, if the result of OGTT is still very high blood glucose, naabot na po yung level ng diabetes mellitus patient, DM na yun. That is already DM. Ma'am, pwede pala yung GDM tapos naging DM full-blown. Check. Maraming case na gano'n. Two-step OGTT, just to emphasize, guys, sinabi ko na to, baka babi, itanong to sa'yo sa board exam, paulit-ulit, ha? Perform a 50-gram glucose load testing using nakalagay dyan, ha? Ma'am, non-fasting sample. Tama. Alam mo, guys, kung ano ngayon, actual internship ka, napansin mo yan. Parang nakita ko na tong patient na to the other week. Parang nakakain ako ng alikabok. Alam nyo guys, sa Pioneer, pa nag-lecture kami, nakakain kami ng lamok, kulisap, hindi naman langaw, kulisap, tsaka mga lamok. Sabi ng mga reviewers, di nakakain po ako ng lamok. Ay, mabuti na nakain mo siya kaysa kinagat ka. Sabi nila, ay, oo nga. Kasi pagka nakain mo, wala kang dengue, wala kang malaria. Eh, pag ikaw nakagat, oo nga. Excellent reasoning. O, balik tayo dito guys ha. Children, tandaan mo ito ha. Sa two-step OGTT, the priming dose or the step 1 can be given in a pregnant woman non-fasting. Ma'am, kakakain lang niya 5 minutes ago. Correct. Ma'am, kainom lang na ng juice, soda, kakain lang niya ng ice cream, milk tea. Pwede na po painumin ng 50-gram glucose load? Oh, of course, that is according to the two-step procedure. And with plasma glucose measurement at 1 hour. Take note, plasma glucose measurement at 1 hour. If the plasma glucose level, ito yung sinasabi ko sa inyo kanina, measured after the glucose load is greater than or equal to 130, reach 135, reach 140, there should be two-step. So ano sasabihin mo? Ma'am, bakit nilang nilagay na greater than or equal to 130? Bakit meron pang 135? Bakit meron pang 140? Eh di sana tinanggal yung dalawang yan. Children, hindi ko siya pwedeng alisin ha. Why? Kasi yan yung nasa standard guidelines. So in short, isa lang iisipin mo, oh, so therefore, are you saying, Dr. Rodriguez, that if after that step one, if after the step one in two-step OGTT, after the 50-gram glucose load, non-fasting sample, the 50-gram glucose load was given to patient, ininom ni patient yung 50-gram glucose load, dissolved in water, non-fasting ang sample niya, nakakakain lang nun, pinainom mo pa, hindi requirement ng fasting sample, yun na non-fasting. After 1 hour, kinuha na mo ng blood. Ma'am, 1 p.m. po ininom ni patient, correct. Kailan dapat matapos yan? 1:05 p.m. Dapat 1:05 p.m. na ubos na ni patient yan. Walang natapon. Completely ingested. O, kailan siya kukuha na ng blood? 2:05 p.m. Ma'am, kakakain lang yun ng lunch ng 12. Walang problema kasi nga non-fasting. O, ano daw ang result? 1:30 and above. Ako lang ha. Kahit makalimutan mo ng 1:35, kahit makalimutan mo yung 1:40, tandaan mo lang, pag tumungtong ng 1:30, there is a two-step. Tumungtong ng 1:31 and above, there is a two-step. 1:30 and above, there is a two-step. 1:30 exact, there is a two-step. Ano yung two-step? Follow up dose. Ilan na ang ibibigay? 100 gram. And this time, it is a fasting sample. Take note of this, people. Huwag mo itong kakalimutan. That is the two-step. But what is the commonly used OGTT method in GDM? The one-step method. Isang beses mo lang paiinumin ng glucose load. And you will ask me, Mom, is the 75-gram fasting or non-fasting sample? Fasting sample. Ang 50-gram lang ang non-fasting. Ang 100-gram, fasting follow-up dose yan. Eh yung 75-gram, fasting sample. What else, guys? Then we have the other specific types of DM. Take note, ha. Yung mga may books, revised na. Ito yung revised. This is the revised 2022 guidelines for the other specific types of DM. I said those who have the review book, this is the revised. No? Ito ang susundin mo, hindi yung nasa textbook. Ha? Ito. What is the first? The pancreatic disease. Okay? Ay, wait lang. Bakit ito ang nakalagay? Take note. Para pati ako, wait lang, children. Why? Ay, hindi ko pala nabura. Sorry, Lord. Sore eyes. Diba ang bilis ng mindset ni Madam? Okay. Sabi nga nila, kabisado ni Madam ang clinical chem at mga bacteria. Hindi naman. Yung mga magte-take ng board exam ngayong August, merong bagong mga subsets ang Staphylococcus aureus, ha? May mga bagong subsets yan. Huwag mong kalilimutan. Aralin mo yung maigi pag diniscuss ni Dr. Arconado. Nasa na siya? Hindi ko na siya makita. It's there. I know. It's there. Okay. That's it. Let's go back, guys. Okay. Ito. Let's share. That's it. Oh, other types of diabetes. May question dito. Ma'am, halimbawa po si patient kumain, uminom, while waiting for the next hour. Ano po mangyayari? Remember, guys, you always instruct the patient. Whether it is the one-step or the two-step method, OGTT, ha? This is an excellent question from Marie Loren Paula Mendoza, ha? We should say thank you to her, ha? This is an excellent question from Maria Loren Paula Mendoza. Ma, para pa kumain si patient during the waiting period, sabi niya. Oops, the medical technologist should instruct the patient, Ma'am, sir, during the waiting period for the next hour collection, whether it is one-step or two-step, lalo na sa pregnant, one-step or two-step, children, ang GDM lang po ang may one-step at saka two-step OGTT method, ha? GDM patient lang, suspected GDM lang ang may one-step at saka two-step OGTT method. Ma'am, paano kung non-pregnant female? Only the one-step method. Ma'am, paano kung male? Suspected DM, one-step method. Ma'am, paano kung pregnant? Suspected GDM. There are two choices, the one-step or the two-step. So in other words, either of the OGTT methods during the waiting period, we always instruct the patient before the start of the sample collection, non-fasting or fasting sample collection, before the start of sample collection. We always instruct patient, sir, ma'am, please understand that once we start this testing, you are not allowed to drink anything, eat anything, even smoking. You are not even allowed to go up and down the stairs because that is a form of exercise. Let us all understand that glucose is the main source of energy. When you walk, when you climb the stairs, when you think, when you explain something, you are consuming glucose and you are consuming ATP. That's the reason why you have to relax and sit there while waiting for the next hour sampling without taking anything, without drinking anything. Is it clear, children? Klarado ba? Andiyan pa ba kayo? Okay. Thank you, ma'am. Sabi ni Crystal po. Thank you, Arvin Antonio. I love that. Crystal. Children, that is so important. Ma'am, bakit? Oh, eto ha, baka may nagsasabi dito, Ma'am, nakinig na ako sa lecture mo last year. Bakit ang bagal-bagal mo ngayon, ma'am, nung nag-lecture ka sa amin last year? Sobrang ang bilis mo magsalita. Mabilis ako magsalita. Eh, bakit kayo, ma'am, ang bagal? Because yung mga students dito ng old curriculum ba, baka ang comment mo, di, nakinig na ako sa iyo last time, hindi ko naman ganyan mag-lecture, ang bilis-bilis mo sa amin. Mabilis talaga ako mag-lecture. Eh, bakit dito ma'am sa new curriculum ang bagal mo? Because they came from blended learning. Galing ito ng mga on-site. In fact, kaya baka ngayon lang nila narinig si Fulminant. Ni-lecture na yan dati. Eh, bakit ba hindi ko narinig? May pinagdadaanan ka. Baka nag-CR ka. Baka hindi ka naka-attend sa lecture. Marami tayong struggles. Kaya binabagalan ko ng konti kasi this is licensure examination, people. Other types of diabetes mellitus, according to me, auto-DM. Ako lang ito ha. Wala ka makikita sa book na auto-DM. That is just my cue. Auto-DM. Ano yon? Other types of DM. DM due to pancreatic disorder, yung mga may book, hindi mo na susundin yan. Expired na yan. Yung page ng other types. Ito ang susundin mo. Itong other types of DM. This is the revised. DM due to pancreatic disorder. Pancreatogenic DM. Amazing. Now, what is that? This is due to chronic. The hyperglycemia was a product of chronic pancreatitis, pancreatic cancer, and may be caused by pancreatectomy. Ay, kaya pala DM due to pancreatic disorder. Pancreatogenic DM. True. Another DM, not type 1, not type 2, not GDM. Eh, bakit nagkaroon ng hyperglycemia? Pancreatogenic DM. Eh, bakit nagkaroon ng hyperglycemia? Hindi naman type 1, hindi naman absence of insulin, hindi naman absence of insulin receptors, hindi naman GDM. Endocrine disorders. Di ba sabi ko sa iyo, kapag ang mga hyperglycemic hormones, tumaas ang concentration sa blood. Hyperglycemic hormones na, tumaas pa yung concentration sa blood. Eh, that is DM related to endocrine disorders. Cushing syndrome is hypercorticolism. Pheochromocytoma, elevated catecholamines, epinephrine and norepinephrine. Acromegaly, oversecretion of growth hormone. Aldosteronoma, that is abnormal increase of, that is actually tumor. Aldosteronoma, that is a tumor actually in the medulla. And that will also produce elevated blood glucose. And hyperthyroidism, well, T3 and T4 hormones are hyperglycemic hormones. DM caused by genetic syndromes, Down syndrome, individuals with Down syndrome, really they have hyperglycemia. And that is DM caused by genetic syndromes. Okay, take a photo please guys. Pag kinopya mo yan, bukas ka na matatapos. Sinasabi ko sa iyo guys, wala magpo-post ito sa social media or any other platform. This is only for you. And this is your uniqueness. Ito ang binayaran mo sa Pioneer Educational Review Center. That's why this is your uniqueness. Okay, next we have number 4, DM associated with exocrine diseases. My goodness gracious, great balls of fire. Those who had extensive extensive and extended readings. Alam ko na sabi mo, ay, nabasa ko yan. Cystic fibrosis associated diabetes mellitus. Correct. That is DM associated with exocrine diseases. Ma, bakit may underline yan, yung iba wala? Kasi importante yan. Mamaya ipaliliwanag ko yan. Naku, wag na wag mo kalilimutan yan, children. Because it is now discussed in all recently published new editions of clinical chemistry books, and that include the John Bernard Henry book. Wag mong kalilimutan. Kaya naka-underline yan. Mom, cystic fibrosis associated DM, CFADM is under auto-DM. DM due to viral infections, cytomegalovirus and rubella, severe infections, okay guys, may lead to hyperglycemia. At pag may hyperglycemia ka, ibig sabihin yung FBS mo ay 126 and above. That is the operational definition of hyperglycemia. Do not ever forget that. What is the operational definition of hyperglycemia? Having FBS 126 and above. And that is DM. So, ibig sabihin, ang diabetes mellitus, not only because of the absence of insulin, not only because of the absence of insulin receptors, or both, there are other causes. Tama. Drug-induced or chemically induced DM, panalo to guys, due to drugs or chemical inducers of beta cell dysfunction. Dilantin, pentamidine is one of the major causes of chemically induced DM. Guys, are you learning? Did you learn something new? Mom, may chemically induced DM. Ay meron nang chemical meningitis. Not just bacterial, not just viral, not just tuberculous meningitis. There is now chemical meningitis. Naku, makinig ka sa lecture ni Sir Errol Codores, ha? Chemical meningitis, kasi doon yan dinidiscuss. And those that cause impaired insulin action, thiazides and glucocorticoids. Pero huwag mo kakalimutan sa pentamidine, that is the most common cause of chemically induced DM. What else? Pancreatogenic diabetes mellitus. Just to emphasize, oh my goodness gracious, there is a type 1 DM, there is a type 2 DM, there is a fulminant type 1 DM, remember? Now there is a type 3C DM. Ma'am, sino po yung 3A? Ma'am, sino po yung 3B? Yan yung mga other types na hanggang ngayon hindi pa nila masyadong naipapaliwanag ng bonggang-bongga. Basta ang importante, si type 3C, confirm na. What is that? The pancreatogenic diabetes mellitus. Hindi nakalagay na formerly, also known as. It develops as an outcome of pancreatic disease, sinabi ko kanina children, chronic pancreatitis or carcinoma or even pancreatectomy. Ina-emphasize ko lang sa iyo, that is the type 3C DM. It is characterized by insulin deficiency and loss, not just insulin deficiency, and loss of pancreatic polypeptide. Mom, bakit mo pinapaliwanag yan? Ay, pag wala tayong pancreatic polypeptide, wala tayong insulin. So it started with the absence of pancreatic polypeptide. And the pancreatic polypeptide is so important in the creation of insulin. It's like a precursor of insulin. Ma'am, pag type 1 DM, absence of insulin lang, pero hindi pancreatic polypeptide. Tama. So pagkasama na si pancreatic polypeptide, type 3C DM. Is it clear, children? Parang hindi ata masaya itong mga tinuturuan ko. Natutuwa ba kayo? Guys, that is type 3CDM. Okay? What else? That is for you and not for general consumption, people. Glucose methodologies, well, glucose in whole blood is 10 to 50% lower than in serum or plasma. Take note, ma, bakit po ganyan? Because whole blood contains red cells, and red cells consume glucose because whole blood contains white blood cells. And if that is leukocytosis, oh, that leukocytosis promotes glycolysis. Kaya nakalagay siya 10 to 15% lower than in serum or plasma. And venous plasma is recommended for diagnosis of DM. Alam ko na ang sasabihin ng iba, Ma'am, alam mo, nalilito po ako dyan, Ma'am. Ma'am, di ba ginagamit natin Venus serum? Bakit po dito Venus plasma? I will explain later. Basta tandaan mo lang yan. Nasa book yan. Venus plasma is recommended for diagnosis of DM. Nakalagay dito, serum. Ano ba talaga? Plasma ba talaga or serum? Kapag serum daw ang ginamit po, in-explain ko na sa iyo kanina yan, should be separated. Ideally within 30 minutes after clotting and centrifugation to successfully prevent glycolysis. Ma'am, naiwan po yung test tube sa loob ng centrifuge. 1 hour na. Naiwan po yung serum tube. Basahin mo ang question, guys, ha. Yung serum tube po, ma'am, naiwan po sa loob ng centrifuge. 1 hour na. Okay. What is the effect pa? 7 milligram per deciliter per hour decrease in blood glucose at room temperature. Ma'am, yung pong buong serum tube, the entire serum tube was placed inside the refrigerator. Hindi po freezer, ang sinabi ko ha, refrigerator. Ibig sabihin 2 to 8 degrees centigrade was placed inside the refrigerator. Ma'am, will there be glycolysis? Yes, but slight. Because refrigeration is a form of physical preservation of glucose in that sample. So there is glycolysis also, but lower rate. 2 milligram per deciliter per hour at refrigerated temperature. Ma'am, are you saying that glycolysis is a temperature-dependent process? Matagal na po, children. It is a temperature-dependent process. Yes, Mom. You mean we have to read completely the question, because if the question is about glycolysis, we have to check at what temperature. Correct. Mom, natanong na ba yan sa board exam? Sabi nila, guys, hindi ako that's what they're saying. Okay? Hindi ko na-experience na personal, but yun ang sinasabi nila. Ang sabi nila, tandaan mo yung sinabi ni Ma'am Rodriguez na temperature. You have to remember that. That's according to them. Okay? Basahin maigi. Next. Nako, eto na. My goodness gracious, great balls of fire. Ma'am, sabi mo po kanina, if we will use gray top, meaning define as 2 separated gray top tubes. One with sodium fluoride and potassium oxalate. And the sodium fluoride is the anti-glycolytic agent, and the potassium oxalate, ma'am, that is the anticoagulant. Correct. The next preparation is iodoacetate, that is the anti-glycolytic agent, and the heparin, that is the anticoagulant, in 2 separate test tubes. Correct. Sabi mo bang kanina that if we will use the gray top sodium fluoride and potassium oxalate, because that is the most commonly used combination, it actually requires 4 hours to complete the anti-glycolytic activity of sodium fluoride. Check. Nakalagay na yan sa John Bernard Henry book. Check. It requires complete 4 hours. So therefore, ma'am, if you will use the gray top, binigyan ka ng situation. Gray top, sodium fluoride and potassium oxalate, 1 hour pa lang nagsama yung plasma at saka red cell. Hindi pa na-inhibit yung glycolysis, ma'am. 2 hours, 3, 4. It usually more than 4 hours. That's why it is not ideal if you are going to process immediately. Ganun pala, ma'am. Yes, that's why, what is the recommendation? Better use serum tube. So what is best for glucose testing? Is it the gray top, sodium fluoride and potassium oxalate? Depende, basahin mo yung question. If it says there, gray top with more than 4 hours standing, pwede na. Pwede mo nang gamitin. Kung nakalagay lang ma'am, gray top, mahirap kasi hindi niya sinabi ko ilang oras. Pero kung sinabing letter B, serum separator tube, the best sample for glucose test, serum separator tube. Why? Because the gray top choice was not specific. Ang sinabi lang gray top, hindi sinabi ko, ilang oras na ba nag-stand yung gray top? Ay, ganun pala yun, ma'am. Yes. Sa ASCP, parati ko sinasabi, yung review for the ASCP Act. No? Baka itanong din sa'yo sa local board exam. What is the best sample for FBS? Letter A, gray top. Non-specific choice. Letter B, serum separator tube. Serum separator tube. That is so specific. It should be separated 30 minutes before clotting and centrifugation. O, nakalagay dito. So what is the alternate for sodium fluoride and potassium oxalate that will immediately prevent glycolysis? Sodium fluoride with citrate, anticoagulant, is preferred over oxalate. My goodness gracious, great balls of fire. Do not forget that, guys. So, ma'am, hindi na po sodium fluoride and potassium oxalate. Hindi ko sinasabing hindi na. You can still use, according to CLSI, you can still use the sodium fluoride and potassium oxalate provided you allow it to stand 4 hours and above. And remember that the gray top, the sodium fluoride and potassium oxalate can actually prevent glycolysis up to 72 hours or 3 days, provided you allow it to stand 4 hours first before using it. Si sodium fluoride with citrate, ma'am, agad-agad. That's why it is preferred. Take note. CSF glucose is 60% of the plasma glucose concentration. Remember that? What else? Sinabi ko na ito kanina, ma'am, bakit hindi pwedeng whole blood? Mas maganda pa rin ang serum, kaya plasma. Because leukocytosis can lead to excessive glycolysis. Leukocytosis is low blood glucose. High WBC count, low blood glucose. Inversely proportional. High WBC count, low blood glucose. Alam mo, I personally experienced that. Guys, nasa practice ako noon, sabi ko, bakit kaya, alam mo itong pasyenteng ito, natatandaan ko to parang 6 months ago, 7 months ago, parang ang glucose naman ito ay normal. Bakit naman ngayon sobrang baba, 50 na lang? So anong ginawa ni madam? Pumunta, kasi nakita ko, suspected leukemic patient. So I went to the hematology section, I checked the record of this patient, tinignan ko ang kanyang total WBC count. Oh, bongacious. It was so high. So sabi ko, that's why it is low blood glucose this time. What else? And notes to remember. Oh guys, ito notes to remember lang to. Baka tanungin ko sa board exam Perform on any lumbar puncture, ibig sabihin for CSF glucose test. For CSF glucose test. Perform on any time of the day using standard procedures and preferably after a fasting period of at least 4 to 6 hours. Ibig sabihin, kung daw si CSF glucose, you will compare it to fasting plasma glucose or fasting blood sugar, you will compare the CSF glucose. Dapat yun din daw CSF glucose mo. Better collect it after 4 to 6 hour fasting also. Pero bang nakalagay siya talaga namang routine niya. Hindi ka naman nag-require ng fasting CSF sample. Ay, wala. However, sabi gano'n, however, if you want better correlation and you want to compare it with the fasting blood glucose, why not wait for 4 to 6 hour fasting before collecting the CSF sample for CSF glucose? But take note, huwag kang malilito sa board exam. Walang requirement na CSF fasting. Wala. Wala guys, wala. So it is anytime. Kahit gabi, kahit araw-araw, walang, kahit i-compare mo pa siya sa FBS, wala talaga fasting. However, sabi nila, you want better correlation. Kaya pag sinabi sa board exam, for better correlation, fasting CSF. Which of the following is a correct statement for CSF glucose sample collection? Any time of the day, correct. Paano pag magkasama si any time of the day tsaka si fasting, if you would like to measure CSF glucose? Well, kung ang tanong sa iyo is, you just measure CSF glucose without comparing to the fasting blood glucose any time of the day, kasi wala ka namang kino-compare. But if the question says, you will be comparing it with fasting blood glucose, what is for better correlation? Fasting CSF sample. Low blood glucose level is hypoglycemia. Hypoglycorrhea is the low glucose level in CSF. Meningitis, tumor, subarachnoid hemorrhage, and hypoglycemia. And take note, children, that elevated levels of glucose in the blood is the only cause of having an elevated CSF glucose level. Take note, huh? Elevated levels of blood glucose is the only cause so far of elevated CSF glucose level. Huwag mong kalilimutan. Alam ko sinabi yan sa'yo sa, sa UBF. Inuulit ko lang dito, ha? Huwag mong kalilimutan yan, children, ha? Very important yan. What else, people? What else? And yung mga low glucose level in CSF, nasa book mo yan. Hypoglycorrhea. What else? According to AAC and ADA lang to, ha? This is now the citrate. According to AAC, American Association for Clinical Chemistry, and American Diabetes Association, in fact, it is also written in the 2022 copyright of John Bernard Henry book, which is now authored by McPherson and Pincus. What is that? The use of citrate anticoagulant mixed with sodium fluoride, take note, is considered a rapid inhibitor of glycolysis. Bakit naka-emphasize yung rapid? Because if you're going to use the sodium fluoride, the potassium oxalate, it takes 4 hours for complete glycolysis. Ma'am, ano pong tawag sa kanyang tube? My goodness gracious, FC mix tube. FC mix tube. Take note. The FC mix tubes contain EDTA, sodium fluoride, citric acid, that is the citrate, and citric acid and another sodium citrate form. So we have the sodium EDTA, the sodium fluoride, the citric acid, and the sodium citrate. Kaya ang tawag sa kanya, citrate buffer. Ibig sabihin, ma'am, sa FC mix tube, parang pink din po ang color. Basahin mo ang pink ng maigi sa board exam. Pink top. Ma'am, wala po ko nakita ang ABORH typing. Okay. Ma'am, wala rin po ko nakita choices na compatibility test. Okay. Ma'am, wala rin pong cross-patching. Ma'am, wala rin special antibody test. Okay. Meron ko ba nakitang for measurement of plasma glucose? Ma'am, meron. Then that is the correct answer. Tandaan mo, children, anong anticoagulant ang nasa FC mix tubes, which is known as a rapid inhibitor of glycolysis tube, which is known as a rapid inhibitor of glycolysis tube. Ano pong anticoagulant ang nakalagay dyan? What is the answer? EDTA. That is the EDTA. Mom, what is the role of the citrate in that particular thing? Actually, the role of the citrate there is more of a buffer. Mom, paano pag inilagay sa board exam citrate anticoagulant? Pwede. You mean, ma'am, citrate anticoagulant and EDTA anticoagulant in the FC mix tube? Check. Because the citrate there acts as a buffer to maintain the blood pH. But take note, it is an anticoagulant. Yung citrate mo sa blue top, nandito na sa FC mix tubes, which is used for which is considered as a rapid inhibitor of glycolysis. Take note of that. That is the source, guys. Take note, people. That is so important. Take a photo, please. It's not in your book. It's not also, those who do not have a book, guys, take a photo. Dalawang anticoagulant, EDTA tsaka citrate. EDTA tsaka citrate. You have your anti-glycolytic agent, fluoride, and you also have your citric acid there, which acts as, that is actually the buffer, the citric acid. What else? The standard clinical laboratory analysis of glucose is performed on plasma or serum derived from a phlebotomy specimen. Guys, galing na yan kay McPherson, ha? Hindi lang sa akin galing yan, children. Kasi parati ko sinasabi that you can either use plasma or serum. Pag sinabi mong plasma, ma'am, anong plasma yon? Coming from gray top. Ma'am, anong plasma yon? Coming from FC mix tube. What is the color of the top? Pink. Nag-iisip ka, talagang pink may EDTA, ano? Tama. Kasi yung FC mixed tubes, dalawa ang anticoagulant. May EDTA ka, tsaka meron kang sodium citrate. Remember that. Because the citric acid there is actually the buffer. But, for the diagnosis of diabetes, eto na children, ano sinabi ni, or for the diagnosis of diabetes, which is present in McPherson and Pincus 2022. Ayun pala yung sinasabi ni Ma'am Rodriguez lagi sa book niya na venous plasma is the recommended sample. Truly, laboratory plasma glucose measurements are recommended. It should be plasma. Bakit? Because we need to avoid glycolysis, in vitro glycolysis, to achieve an accurate result. You want to measure glucose, blood glucose, FBS. Wala namang diabetes yung pasyente, not yet true defined diabetes. You can use plasma, you can use serum. Ma'am, anong plasma yon? Gray top. Ma'am, anong plasma yon? FC mixed tube, pink top. Pero, kung yan talaga ay may diabetes mellitus, we have to avoid any factor that may cause false decrease or false increase results. So how do we avoid false decrease because of glycolysis? Then we have to use plasma. Ma'am, anong klaseng plasma? Gray top na naman kasi meron ka doon potassium oxalate and the anti-glycolytic agent. Bakit pink top? I'm referring to the FC mixed tube. Bakit mixed? Dalawa kasi ang anticoagulant mo. Ano yung isa? EDTA. Ano yung pangalawa? Sodium citrate. Ma'am, walang anti-glycolytic agent. There is. What is that anti-glycolytic agent? Sodium chloride. Ma'am, are you saying that the FC mixed tube is an anti-glycolytic tube? Yes. Rapid inhibitor of glycolysis. You don't need to wait for 4 hours. Children, nagkakaintindihan ba tayo? There are 2 anti-glycolytic tubes now, the gray and the pink. Pero lagi si pink, tatanda mo ang tawag sa kanya, FC mixed tube. Bakit F? Fluoride. Bakit C? Citrate. Bakit mixed? Meron ka ng EDTA, meron ka pang sodium citrate anticoagulants. Remember that the citric acid is the buffer. Children, nagkakaintindihan ba tayo? Basahin mo pong maigi ang question ha, para hindi tayo malilito. So therefore, question now, how do we measure blood glucose? Well, there is a chemical method and there is an enzymatic method. Chemical method and enzymatic method. For the chemical method, do not forget, those who have the review book, meron ka dyan makikitang Folin-Wu, arsenomolybdate, you have their neocoproane, H-Dorn-Jensen, orthotol-within method. These are all obsolete chemical methods. Hindi na po natin ginagamit sa clinical chemistry. They're all obsolete chemical methods. However, kahit obsolete na, remember the orthotol-within method. The orthotol-within method is a commonly used chemical method then. The orthotol-within method with Joubowski reaction. Anong spelling ng Joubowski? D-U-B-O-W-S-K-I. D-U-B-O-W-S-K-I. Huwag kalimutan. Take note. And then what else? And the end product is Schiff's base. Green colored compound. That is a colorimetric method. Green colored compound using glacial acetic acid. That is a common procedure then wala pang enzymatic method. Okay? Then, also do not forget, H-Dorn-Jensen method, the Hagedorn-Jensen method. Hagedorn-Jensen, according to me, ha? Ako lang ito guys, ha? Ako lang, according to me. That is a unique method. Bakit siya tinawag na unique method? Unique. Because this is the only colorimetric method in the whole clinical chemistry as far as I know. The only colorimetric method wherein the end product is a colorless compound. The end product is a colorless compound. Kasi pag sinabi mong colorimetric, ano dapat ang end color? Ang end product, colored. colored compound or colored end product. Eto, colorless. So, ano ang description ng H-Dorn-Jensen or the Hagedorn-Jensen method? It is a what? Inverse colorimetric method. Inverse colorimetric method. Take note, inverse colorimetric method because the end product is colorless. Again, they are all obsolete methods. So, mga na pong methods sa lab, enzymatic methods, these are specific methods. The first is glucose oxidase method for measurement of glucose, guys. Fasting blood glucose sample, OGTT sample, we use glucose oxidase method. This is one of the routine methods for measurement of glucose. Here, we can use serum, we can use plasma, we can use whole blood, urine, CSF, and other biological fluids. Oops, Mom, there is a CSF glucose test. Yes, we can even measure glucose in peritoneal fluid, in pleural fluid, guys, peritoneal fluid, pleural fluid, pericardial fluid, and CSF. Take note, guys, we can measure glucose. Ano pong method? Glucose oxidase method. Mga ibig sabihin, the machines in clinical chemistry, the robotics in clinical chemistry also accept other samples, not just serum, not just whole blood, not just plasma, but even urine, even CSF, even other body fluids. Yes, and glucose oxidase is one of the routine methods for measurement of glucose in those samples. And here, glucose oxidase method, always remember, it measures only the beta-D glucose. Take note of that. It only measures the beta-D glucose. Ma'am, paano ko yung glucose hindi po nasa beta-D form? Walang problema because glucose oxidase reagent contains mutarotase enzyme reagent. The glucose oxidase reagent contains mutarotase, mutarotase. Again, mutarotase enzyme reagent, mutarotase reagent. That is mutarotase reagent. What is the purpose of that enzyme reagent? To convert other forms of glucose into beta-D glucose. Again, to confirm other forms of glucose into beta-D glucose. Ay, so ang galing pa. Ibig sabihin, lahat ng forms of glucose measure na because it's converted to beta-D. Correct. That's why this is routine method. Example of chromogenic reagent, kasi nakalagay colorimetric to. Enzymatic and colorimetric method. So we use a reagent. Take note, yung reagent mo colorless, pero siya yung chromogenic reagent. Ibig sabihin, it will give color to the end product. Glucose oxidase is the enzyme reagent that will react with the glucose in the sample, and the products are gluconic acid and hydrogen peroxide. In the second reaction, hydrogen peroxide plus the chromogenic orthodianisidine reagent. Tandaan children, na colorless reagent yan. But the end product, so it is colorimetric enzymatic, the end product is oxidized chromogenic substance. Take note of that. And ascorbic acid or vitamin C or ascorbic interferes measurement of glucose under glucose oxidase method. At what level? The presence of increased concentration of ascorbic acid results to what? False decrease of glucose. Ke whole blood, ke plasma, ke serum, ke urine. Whatever biological fluid, guys, no, with increased concentrations of vitamin C, false decrease of glucose. If the method is glucose oxidase. Take note of that. How about hexokinase method? This is still the considered reference method. This is the reference method. And take note that this is the most specific method. Kaya reference, most specific method. This is also considered routine method. Dalawa ang routine methods, guys. Actually, we have the glucose oxidase and the hexokinase. Ang tanong, bakit siya napiling reference method? Because it is the most specific enzymatic method for glucose. Bakit siya ba ang most specific method? Mamaya we will answer that. Mom, can we use hexokinase method for blood, for whole blood, for serum, for plasma, for CSF, for other biological fluids. Yes, except guys, pinag-aralan mo sa UBF kahit online, virtual class, you have your urine strip. And remember, that urine strip with glucose pad. Ang tanong, what is the method in that glucose pad? Hexokinase or glucose oxidase? What is the answer? Glucose oxidase. So, ibig mo sabihin, ma'am, hexokinase is used for all biological fluids except, so far, kasi ang nakalagay sa urine strip glucose pad is not hexokinase method. It is glucose oxidase. So, hexokinase reagent will react with glucose in the specimen, producing glucose 6-phosphate plus ADP. In the second reaction, we need the second enzyme, the glucose 6-phosphate dehydrogenase, which will now catalyze the reaction between the glucose 6-phosphate plus coenzyme. Please encircle that, those with books. Please encircle NADP, nicotinamide, adenine, dinucleotide phosphate. Remember, the